What's up, guys? This is Ray. So today is the 7th of February 2017, and this is actually just going to be a client's briefing of my conclusions with their consultation for an Astro medical diagnosis, and I'm just going to actually read it straight from the paper, because the paper's almost 30 pages long, and we all know how I talk forever, and I don't want to make this any longer than it needs to be. So, the client, which I call ES, is a Gemini Sun Leo Ascendant native that has concerns about some physiological symptoms that are turning chronic. ES told me that the symptoms began late summer of 2016 and their condition is worsening. ES asked if I could confirm if they possibly have early stages of Lyme disease, so my objective first is to disprove or prove that it's Lyme disease, and then to develop ES's Astro medical profile to interpret overall health, physiological symptoms they would experience when their body is trying to tell them that there's a hiccup in their system. I'd like to note that symptoms are not the problem. The symptoms are the manifestation of one's body sounding the alarm that the body is weak and needs immediate intervention. So as a medical astrologer, I'm an advocate for homeopathic alternatives, but I also still encourage professional medical intervention if I believe it's necessary. So, as I was saying, I'd like to mention that I'm not a licensed medical professional. You should always consult your primary care physician before incorporating any regimens or homeopathic treatments into your routine. So before I mapped out the charts, I wanted to understand the characteristics of Lyme disease specifically. I mean, I'm kind of familiar with it, but I wanted to understand what parts of the body impacts and that sort of thing, and how it would interact with the body. So let me grab my medical textbooks. Hardcore stuff. So I've got it's for the actual medical assistant course that I've taken. So it's a medical dictionary. And then I've got the American Medical Association Encyclopedia of Medicine. I've got 2005's current medical diagnosis and treatment books. Already tab some of these so we can try to make this as quick as possible, right? Lyme disease is a multi-system disorder caused by the most common tick-borne disease in the U.S. It occurs most often in the spring or summer when the ticks are most active. Removal of a visible tick before they're attached to gain access to the bloodstream, which usually happens within the first 24 to 48 hours, decreases the risk of transmutation. I'd like to point out that ES also never confirmed that they saw a tick, but the symptoms that they're developing do sound like it could be Lyme disease. So I can understand where somebody would think that. So the infected tick injects saliva into the bloodstream, which can incubate from 3 to 32 days, and then migrate into the skin, causing a characteristics of arrhythmia or migraine or rashes. The diagnosis is at the site of the tick bite, it expands into a ring, leaving a clear center or with a target or a bullseye. The lesion usually feels hot and itchy. I'd like to point out too that the archetype elements for this individual is hot and dry and hot and moist, so they would be feeling those kinds of symptoms if they were having skin lesions in general anyway. The lesion usually, I already said that, says it may grow up to 20 inches in diameter as more lesions erupt. There's only 2 skin abnormalities with this individual as far as they've told me. So some of the symptoms could be, this lesion is later replaced by red blotches, and it could look like conjunctivitis, and they would also experience fatigue and flu-like symptoms, and also issues with their lymphatic system. Symptoms: the course of Lyme disease is divided into 3 stages. Localized infection begins with the tick bite and proceeds above. The second is disseminated infection, begins weeks to months later, spreads to the rest of the body through the bloodstream, in some cases causing arthritis, knee joint pain, muscle pain, or cardiac arrhythmias. Lymphatic issues and non-protective antibodies develop during this stage. The third stage is chronic infection, begins weeks or years after initial bite. Could be from mild to severe arthritis. The treatment would be amoxicillin, effectively for 14 to 21, even 28-day course of antibiotics to treat uncomplicated Lyme disease. Patients with cardiac or neurological involvement may need to be treated with other methods. When the disease is treated early, results are good. If the tick or nymph is found, carefully remove it with tweezers, just in case anybody runs into ticks or has ever gotten bit by a tick or in the future. This is just for beneficial information. The site may then be cleansed with antiseptics and should be observed for infection or swelling or pain. Some people make the mistake of trying to remove it with alcohol or a match or petroleum jelly. This is actually increasing your chance of transmission of the tick-borne illness or infection. Patients being treated for Lyme disease often require antibiotics for prolonged periods of time, especially in advanced stages, which increases the development of all the effects therein. All these books actually just kind of, echo what they were saying, what I was just reading, but I use multiple sources because I shouldn't even have to explain why I use multiple sources. You can't trust just one source anymore nowadays. So Lyme disease is transmitted by ticks. Over 75% of patients have symptoms involving the head or the neck, facial paralysis, and neuralgia, and cranial neuropathies are most common. Headache, pain, or cervical I can never say that right. It's about the lymph nodes, and it's the lymphopathy or whatever, may occur. Okay. Aha. Alright, Lyme disease. A disease characterized by skin changes, flu-like symptoms, and joint inflammation. Lyme disease is caused by the bacteria. It's transmitted by ticks that usually live on deer, but can infest dogs. One thing I'd like to point out too, the client does live in Maine, so that was actually the first thing I thought. I'm like, whoa, maybe they do have Lyme disease, because if anybody's heard of Plum Island and the ticks and everything over there. So the site of the tick bite, a red dot may appear and gradually expand. Symptoms such as fever, headache, lethargy, muscle pains usually develop. Characteristics of joint inflammation, redness, swelling typically affects the knees and large joints. Unless the disease is diagnosed and treated, symptoms may continue for several years and gradually declining in severity. Complications affecting the heart, such as myocarditis or heart block, or in the nervous system, such as meningitis, occur in some cases. If diagnosed before the joint inflammation occurs, the disease can be quickly cleared with antibiotics. To reference the official medical info on that. So, an Astro medical profile defines what heals a native and what weakens them. The birth chart reveals predispositions for possible health conditions. It's not guaranteed to happen, but the potential is there. The possibility of those ailments surfacing all depends on the native's environment, behavior patterns, and their conscious choice to exercise preventative care or neglect their health. Let me explain how the astromedical archetype is defined first, and then we'll jump into my notes. The ascendant sets the stage for everything in the medical profile. The ascendant reveals weaknesses, and the descendant represents symptoms. The fourth house represents the influences of the native's cause of death. The sixth house is health and their attitude towards preventative care. The eighth house represents disease, and the 12th house represents chronic, life-threatening, and or incurable conditions. The first house represents the native's vitality, and the fifth represents overall self and well-being, as the 11th is a trauma signature house. Any planets in the 11th house, or in the sign that rules the 11th house, which is Aquarius, and also which sign rules that native in specifically, will contribute to traumatic symptoms or cause trauma onto the archetype through physiological distress, pain, whatever. Alright. Let's define the archetypal elements of ES. Alright, ES has an ascendant in Leo, so the descendant is Aquarius. Leo rising rules the sun. This individual was actually born on a Sunday, and if you look from ancient rulers and the lords of the day, the sun in this person's chart in particular becomes a more prominent factor, especially when we're looking at the medical profile. So the sun's placement, dignity, and aspects are more prominent. Remember how I said the 11th is a trauma signature? The 11th house is associated with Uranus, and it rules Aquarius. That translates to ES experiencing traumatic physiological symptoms when their vitality is weak. There's a difference between symptoms and the origin of disease. If you're familiar with Hippocrates and I don't think anybody who would say like the Hippocratic Oath, I know, medical majors or whatever, or health professionals or whatever, they've taken a lot of the historical correlations between Hippocrates being an astrologer and a homeopathic doctor out, because they don't want people to know that. But he talks about the origin of disease, that the symptoms don't depict what you have. The symptoms are the red flags that the body is displaying to let you know that there's something wrong. Why there are frequent misdiagnosis incidents, because many diseases display similar symptoms. I just shouldn't have mad with that. So keep in mind, ES will experience symptoms of Leo and Aquarius. Leo rules the spine, the thoracic vertebrae, the heart, and bone marrow. It also governs the spleen and the cardiovascular system. Aquarius rules the ankles, calves, nerve impulses, nervous system, and the circulation. It governs the parathyroid and the circular system. So the Leo Aquarius ascendant descendant would mean ES will have cardiovascular and or circulation problems, aka heart conditions. The sun, a prominent point in the birth chart, will impact overall health more so than usual. A Gemini sun has a Sagittarius polarity, which would translate to weakness of the lungs and nervous system. The influence of Gemini and Aquarius in this profile reveals major neurological challenges like anxiety, nerve pain, overactive electrical energy within the person, which would affect the breathing and heart function. The ruler of the 8th house is Aquarius again, a trauma signature, so Aquarius symptoms are the red flag for a serious form of a disease. Aquarius influencing the 8th would mean abnormal, spastic conditions and or abnormal disease. The planet ruled by Aquarius is located in the 4th house, which signifies the disease progressing in the present time is most likely genetic or hereditary. It also could have infected the native or actually originated from the physical home, or they became ill while they were at home. And then Scorpio ruling the 4th house, which is the sign that Uranus is in for this individual, indicates the origin is some sort of infection or toxicity. Aspects highlighted with this house is a Taurus-Chiron opposition, which is also conjunct with Mars. A Mars-Chiron conjunction represents obvious, even chronic weakness in the native's vitality, immune system, and energy. It's safe to say that this is a reoccurring condition for them. Besides the Taurus-Chiron-Mars conjunction opposing the Scorpio-Uranus placement, the Uranus is also semi-square the Sun in Gemini, which Gemini is also located in the 11th house, another trauma signature. I know I keep saying that a lot, but that's exactly how it translates. And the way that this person's described to me their symptoms, they're probably just, when they watch this, they're going to shake their head and go, oh my god, yeah. And I'm like, yeah. Every time I say trauma, they probably can't even explain the amount of agony that they may be experiencing with these things. I speculate the origin of disease is the Taurus-Scorpio duality. Taurus rules the neck, throat, tonsils, cervical vertebrae, thyroid, and governs over the lymphatic system. Scorpio rules the large intestines, bladder, sweat glands, genitalia, and governs mutation transformation. Pluto is also a contributing factor to tumor and cancer growth as well. Scorpio detoxifies the body and eliminates what is toxic, or at least is supposed to. So I speculate ES has a hereditary condition that's associated with something with Taurus. Other chart signatures are Lilith conjunct Mercury, located in the 11th, opposing Neptune in Sagittarius in the 5th house. Lilith symbolizes toxic or destructive themes. The conjunction with Mercury, ruler of the 6th house, would suggest that the native's habitual behavior or attitude towards preventative care is detrimental to their vitality. So when ES neglects health or shrugs off symptoms, the consequences will result in trauma to the physical body through symptoms or conditions. Using a bi-wheel transit natal chart, I examined the time frame of symptoms with ES's predispositions. So I broke it down for October 2016. ES reported experiencing fatigue, which manifests through that Taurus-Chiron-Mars conjunction. General weakness, also signified by the Sun conjunct Mars, and that's also in the trauma signature house. And the flu-like symptoms, that is the Mercury in Gemini opposition Neptune in Sagittarius, and then into November 2016, a new set of symptoms developed, explaining the intensity I had mentioned. Respiratory issues again is represented by the Gemini Sagittarius duality. And then the stress on the cardiovascular and circulatory systems, via Leo and Aquarius, the AC and the DC, could cause hyperventilating, chest pain, erratic blood pressure, adding stress to the heart, and intensifying the already overcharged nervous system. Assuming ES is has the typical manic behavior, such as anxiety, which impacts the nervous system, the cardiovascular system itself, now with an infection or toxicity is adding more stress to the body and is essentially in complete panic and meltdown mode, similar to an autoimmune disorder, or the immune system itself could be contributing to the source. So if there's an infection and they have a weak immune system, or they're having issues with their immune system working properly, this would coincide with if they already kind of had like an autoimmune disorder, which would be a hereditary thing, and they weren't aware of it, and now they've developed some sort of, bacteria somewhere from eating something, or, malnutrition or whatever, or even eating seafood for that matter, because they live off the Atlantic coast. There could be some sort of radicals or toxic stuff that wasn't able to break down, and that might be the source of it, and their body's just not purging it because they have an autoimmune disorder. That would make total sense. Like I said, I can give you an idea of the origin of it, but I don't have like the tests and stuff like, medical professionals would. That would be like something that blood work and everything would have to be done for. So I speculate that it's some sort of autoimmune disease, thyroid, or any lymphatic disorder, which all three could result in bacteria toxicity or an infection in the body. ES has skin abnormalities as a symptom. The native has Saturn in Leo in the first house, indicating chronic, lifelong limitations or conditions associated with Leo and Aquarius. 2 skin abnormalities present, a bump on the Taurus and Gemini region of the body, she has it like right here, and then a lesion on the Aquarius region of the body, on the back of by their ankle. ES has Neptune and Sagittarius in the house of overall well-being, opposing all those personal planets, and Neptune rules the 12th house of terminal, life-threatening, or incurable diseases. It's not always guaranteed to be all three of those, it would be one of them. So an incurable disease would be likely a hereditary disease, and it would just be something that they would have to deal with their whole life. Like I have asthma, that's an incurable disease, but I have things to treat it, and I can take things that help with asthma and airways and all that stuff. Okay, so December 2016, symptoms worsening, erratic heart conditions, blood pressure, and when Uranus went direct in late December, it's more than likely that intensified the stress on the nervous system, breathing, which would make breathing, chest pain, and heart rate even more erratic. And she did say in December that it had been getting substantially worse. So examining the transit placements and how it affects ES's predispositions from September 2016 to present, Capricorn and Pluto transiting over the 6th house of health and attitude towards preventative care. ES is now being forced by Pluto to purge toxic lifestyle choices, a destructive habitual behavior, or it will escalate into traumatizing painful demise. Neptune in Pisces transiting the 8th house signifies lifelong conditions or genetic factors will now worsen or surface first as an acute disease and eventually be considered chronic. Saturn in Sagittarius is now transiting the 5th house and will at some point this year be conjunct, meaning Saturn will punish the self for neglecting any important health conditions that are associated with Neptune and Sagittarius. Saturn also has been in opposition with all of ES's personal planets in the 11th house trauma signature. It is likely the major transit that was the Neptune square Saturn and then square Jupiter. So it was Jupiter and Neptune were opposing each other, and then when we threw the square in with Saturn there, it made that T-square, which was intense. Has acted like a trigger for more of the traumatic symptoms. And then also another trigger symptom for the transit would be Lilith in Scorpio, has been transiting near the IC and already had a conjunction with Uranus in Scorpio, which is the origin of this infection. And this is around actually when the symptoms began. This was around summer of summer of 2016 when that conjunction happened, which correlates with when this person was telling me that the symptoms began. This translates to an acute infection with sudden, unpredictable, abnormal health problems, traumatizing the body's nervous, cardiovascular, and lymphatic systems. Lilith and Scorpio opposing the Chiron-Mars-Taurus conjunction means it likely is a thyroid or lymphatic abnormality, and the result of this is a radical cell growth or built-up toxins in the body regions of Taurus or Scorpio. Through 2017, Saturn and Sagittarius opposing the native Sun in the 11th house will intensify the symptoms, and the acute condition will develop into chronic and or life-threatening. That being said, client ES has requested treatment along with this diagnosis. It's progressed too far for homeopathic treatments to reverse the damage. I have some recommendations that have little to no side effects with prescription drugs, but it looks like this person will need antibiotics anyway, and there's very little natural remedies or natural kind of medicinal things that really counteract with antibiotics. In fact, garlic and turmeric actually helps the antibiotics. Recommendations that have little to no side effects with prescription drugs, but strong long-term steroids and antibiotics are required at this point. I will recommend detoxification techniques, but the treatments are not guaranteed to cure or eliminate the bacteria infection present. The infection is located in a Taurus or Scorpio region. That's the throat, neck, thyroid, and one of the marks that's right there is right near the Taurus area. And also Scorpio rules over sweat glands and toxins, so that could actually be some of the toxic bacteria collecting right there and trying to push itself out of the sweat glands. It's totally possible. Again, I'm not a doctor, so you need to, yeah. And I actually haven't physically seen it, so there's that too. But and it says the large intestines, bladder, and sweat glands are also associated with Scorpio. I also suspect that the colon there may be a bacteria infection in the colon. That's specifically if they've been eating seafood or contaminated food in some way. Because this could, I'm not saying it is, but there is a chance it could be the development of cancer too. But don't get freaked out and start thinking I just told you have cancer. It's just something worth checking out. This person's going to have to go see a medical professional one way or another, no matter what this bacteria or infection's from, because antibiotics, really strong, hardcore antibiotics, are needed. So you can figure that out once you go there. My advice, because I go to doctors and they don't know what's wrong with you anymore nowadays, I actually diagnose myself before I go, and I go and say, so I have an infection here, here, here. I was like, I think it's this. Instead of sitting there for 5 hours and letting like their nurses that I don't even know how they even passed their board's test try to guess like it's Wheel of Fortune. I wonder what's wrong with them. Yeah, no. At some point, the doctors actually started listening to me, like the ones here, because my ex was continually having problems. I'm like, he has gastroparesis. I ended up doing a diagnosis for him, and I said, there's something saying that your stomach won't work in the chart. So let's look up, medical conditions of that. And they didn't even know he had gastroparesis until I said that, and they had a scope done. Yeah. I'm getting sidetracked, sorry. I would make a recommendation for the Gerson therapy juicing. It would eliminate the toxins in the digestive system, but for the neck and throat, it would need antibiotics. Do I have my Gerson therapy book over here? The Gerson therapy book is really hardcore. It's like a juice fast. You can actually get this, I think, on Amazon. It comes with a DVD, too, to tell you about it, and this has, like, different, not only does it fill you in on what it does, but it's over 100 years of research with detoxifying the body with juicing. But that would be the Gerson therapy thing. This pretty much almost cures everything. You see that? Defeating cancer and other chronic diseases. Can't give recommendations to other people, technically. But if this were me, I'd go to a clinic or schedule an appointment with my primary care doctor. So that's pretty much the gist of my diagnosis. I'll go over the actual planetary translations now of every single planet and sign in this person's natal chart. So, the ES natal medical profile. A moon in Taurus would indicate thyroid sensitivity. A sun in Gemini at 21 degrees would indicate they have asthma or weak lungs. Saturn Leo would in the first house would indicate heart attack like potential heart attack, extreme blood pressure issues, restricting the heart muscles and function. The symptoms would surface as either a Taurus condition, Scorpio, or Aquarius ailments. Aquarius is, the nervous system, and it coincides with the cardiovascular system, and then Taurus is the thyroid and the lymphatic, that sort of thing. And then Scorpio is supposed to eliminate toxins, so if there's an infection going on, that would point to an autoimmune disorder also. So then Mars in Taurus is a hypothyroid condition could be possible, wounds or some sort of condition in the neck or the Taurus region, which is going on. Toxin buildup is likely in the colon. Symptoms surface as Scorpio, Leo, or Aquarius ailments again. Then Jupiter in Gemini, lung ailments will be a lifelong thing. Possible tumors in the Gemini region, which would be the lungs, the chest, or the arms. Again, that spot is right there. I'm not saying that thing is cancerous, but it's worth asking. With arms and legs. So, yeah, tumor growth, the lesions on the person's ankle, I don't think would be cancerous. So, Mercury in Gemini, tremors, asthma, respiratory irritations, intercostal neuralgia, and nerve pain would be attributed to that. That being in the 11th house, also associated with Aquarius and the nervous system and everything, is going to intensify those kinds of feelings. So nervous pains or nerve pain in general, or neuropathy. So Uranus in Scorpio signifies a spastic colon. So think back to when I said Uranus in Scorpio is essentially the origin in the chart for this infection, and it's associated with the colon. So when Lilith went over the Uranus, and then as well we had obviously Saturn going over this person's Neptune opposing their sun, that is likely the trigger of when that happened, and it might be something that they actually developed some sort of condition or radicals in their colon, and their body's having problems detoxing and pushing it out, which is what the Gerson therapy regimen would help with. Also, it represents genetic diseases. Symptoms surface as Taurus, Aquarius, or Leo ailments again. So Neptune in Sagittarius, weakened lungs, multiple sclerosis could develop. So I should have actually, did I? Wait a minute. Yeah, MS, okay, I did. A chronic disease of the central nervous system in which there is destruction of the myelin with several regions of the brain and spinal cord at different times. Leo rules the spinal cord. That's right. This results in temporary, repetitive, or sustained disruptions in the nervous impulse, causing symptoms such as muscular weakness, loss of coordination, numbness, visual disturbances, loss of control, bowel, bladder, and sexual functions. Oh, that's a Scorpio thing. There you go. Clinical picture of MS depends upon the extent of the demyelination. Multiple sclerosis is a relatively common disorder. Multiple sclerosis usually begins between ages 20 to 40. Women are twice as likely to have the disease than men. And 4 main categories of MS are currently recognized. The benign variant is marked by several episodes of nervous system dysfunction, followed by complete recovery. The primary progressive variant is marked with rapid loss of neurological functions that do not resolve, causing severe functional impairment and then worsening over time. The more common either of these types of MS is the 2 relapsing readmitting variants. In patients with these disorders, neurological deficits, which would this person could potentially have, develop and then improve improve either completely or partially. The patients who achieve a partial restoration of neurological function, secondary progression of the disease may result in gradual accumulation of visual or motor or sensory disabilities. The disease is unknown, although much suggests that the lymphocytes that injure nerve cells and nerve sheaths play an important role. That is, that the disease has an autoimmune basis. Some evidence links MS to hypervitamosis or vitamin D. Diagnosis is usually based on patient's history. MRI may detect areas in the brain and or spinal cord. Lumbar puncture is often performed to assess patients' bands, which are associated with the immune system released into the cerebral spinal fluid that results in inflammation. So. Well, I know that I, wrote that down because that could have been a possible factor. But now that I'm talking about this out loud, because I changed my mind a lot, there's a good chance it could be MS. This person has the predisposition for it, like I said. So, oh yeah, in Neptune and Sagittarius. Whoa, Saturn's supposed to be lifelong conditions, and then Saturn's in the first house. So this is what happens when I do this live on the fly. When I'm by myself, the theatrics are entertaining. How excited I get when I figure stuff out. So, the arterial insufficiency leaks. So there could be artery walls in your heart that are having issues. And that would go back to like the Sagittarius kind of circulation thing. Symptoms surface as Gemini, Pisces, or Virgo ailments. So Gemini would rule the lungs, the ligaments, and then Pisces is circulation, the feet. I have my thing. Where is it? My cheat sheet. Feet, toes, body fluids, immune system, and lymph nodes for Pisces. And Neptune is ruled by Pisces. The chromatic, the pineal and lymph glands, and the immune system. Yep. And then Gemini, shoulders, arms, hands, lungs, and nerves. And Virgo, abdomen, small intestine, solar plexus, and nerves. So all of them have in common nerves and extremities. Nerves and extremities. Okay. We have a south node in Aries, which would be weakened blood vessels in the brain. And when I just heard that MS thing, they were talking about there being those sorts of abnormalities as well. And then we have a north node in Libra, which I wrote down toxema, Toxemia, toxema, gout, because gout's usually associated with Taurus stuff too, and lumbago. I told you I'm not a doctor, I can't pronounce all that stuff. So I narrowed it down to, as soon as I saw the toxema thing, I instantly was like, oh my gosh, that sounds exactly like something I should probably look into. So toxema is brought on by toxin buildup, likely in the native's colon, or toxic buildup in the throat region, or perhaps the lungs. I've determined from the birth chart that the planet rulers that contribute to the origin of this indicate that it is genetic or hereditary condition. Therefore, I rule out that it could be Lyme disease for the following reasons. The native cannot verify for sure that they had a tick present, which needs to be on there, and if you even take them off soon enough, like I read in that one book, you can actually avoid the transition of the disease. The birth chart reveals predispositions for certain ailments and health conditions that generate the same symptoms as Lyme disease. Lyme disease is a transmitted infection, therefore wouldn't be hereditary. Symptoms. I swear to you, I organized the papers before I started. I think these are just general medical astrology associative symptoms. Throughout my notes, multiple potential health conditions were highlighted. We can confirm that heart conditions will be an ailment this person will have to fight, so I review the criteria. As I reviewed the criteria, the origin of the disease has to be genetic or hereditary, history of it in the family. The origin is some sort of infection or bacteria, and the condition must be associated with Taurus or Scorpio duality. And I pointed those out thoroughly throughout talking about this. I'm going to stop this now because it's almost 40 minutes, and yeah, if I have any, I know some people wanted me to like retype or something my whiteboard notes because they can't read my chicken scratch that I posted on Facebook. I'll actually probably just read them in a video and upload it and not make it this long, because it should not be this long. It's just associations. But yeah, so that is the conclusive consultation to an Astro medical diagnosis. And so if you're ever interested in contacting me about any kind of conditions or anything, that also any kind of mental or mental concerns, mental disorders, mood disorders and stuff, I can help you with that too. Just hit me up and let me know. And thanks to the client for allowing me to share this information. And hope that they get this checked out and go get some antibiotics and go see a medical professional immediately. And then we can talk about some of my tinctures I'll send you. Okay? Asta, guys.